Hi everyone, this is a video about lymph drainage support. Just before I jump into the video, as per usual, nothing that I am saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. So someone posted a question on one of my other videos, and I'll just read it out because that way I'll do it full justice by reading it out verbatim. So it says, what are the best herbs or supplements to take for lymphatic drainage? Where can I learn about targeted dry skin brushing? Targeted dry skin brushing being something that I've mentioned a few times in other videos. So good questions. So as far as herbs and supplements go for lymph drainage, what I've found is that there's really nothing that beats, and there's no hard and fast rules, of course, but generally speaking, there's nothing that beats actual manual treatment for getting the lymph moving. So the targeted skin brushing, I find, really works the very, very best. And that's a system that was developed by a chiropractor. I don't remember his name. My wife, who's also a naturopathic doctor, she took a course of his, learned this technique. I don't even think he calls it targeted dry skin brushing. That's just what we call it. I don't remember what his name is, but he has a website. I believe it's called Stop Chasing Pain. And if you look that up, that he talks a lot about lymph and a whole bunch of great exercises, and he has a great Instagram profile. I follow him on Instagram. I think it might be just Stop Chasing Pain, might be his handle. So I highly recommend his material. I think he's a really brilliant guy. Just don't know his name, and I haven't had a chance to do his course myself, but learn this technique, and it's just great. I've had patients who have like golf ball size lymph nodes that just will not go down for the life of them, and yet we start doing this targeted skin brushing and it makes a really significant difference. I had to pause my video. I had a knock on my door. So anyways, I remember I was talking about targeted skin brushing. So anyways, it's nothing has really compared to that in terms of bringing down like really large palpable lymph nodes. And also just in terms of even folks who don't have large palpable lymph nodes, comparing other treatments for lymph support, I've not seen anything work as well on average than targeted skin brushing. So it's a really great technique, and I recommend it to my patients on a regular basis. With that being said, there are certainly agents that can be taken internally that are there to help support the lymph. And I've certainly seen some of these agents work well for my patients before. Some of my favorite herbs to help support the lymphatics are burdock and also another herb called cleavers. So I'll usually recommend those in combination, usually in equal parts as an herbal tincture, although they could certainly work in other forms as well. What I find though is that in terms of the effects of the burdock and the cleavers, I really don't know if they help a patient really because they're moving the lymph more, or if it's because they have other detoxification enhancing effects. They have beneficial effects on the liver and the kidneys. So I really don't know exactly what to ascribe their benefits to, but I've certainly seen them help other patients. But if I had a patient who had, say, really enlarged lymph nodes or a lot of symptoms of lymph congestion, I would say that they're not super reliable in terms of their ability to kind of get the lymph moving super well. Again, I've seen them help patients. I think they're really great detox support herbs, but they just don't compare pound for pound to targeted skin brushing in many cases. But if for some reason we couldn't do targeted skin brushing, it would certainly be a reasonable option to consider. The other thing that I've seen quite a lot of therapeutic benefit from, and I've seen quite a lot of flare-ups from, is using drainage therapy. Drainage therapy is kind of a whole big topic, and it falls under the category of what's called homotoxicological medicine, which is a weird name. Where do they come up with these terms? But basically, homotoxicology is the easiest way to describe it is it's kind of like a bridge point between homeopathy and, say, herbal medicine. So herbal medicine, we have these like tangible physical doses of herbs that we're working with at certain concentrations, usually fairly robust concentrations, kind of like akin to, milligram dosages like we'd be seeing with, pharmaceutical drugs. And then there's homeopathy, which generally are preparations that are so dilute that there's barely any material left in the actual homeopathic formula, or it's so dilute that there's actually literally no physical material left in that formula. There's just sort of the oh my gosh, what's the word I'm looking for here? They're trying to think of a less woo-woo term, but it was basically frequencies of the, I can't think of the word now. Anyways, frequencies basically left of the original substance in question. So homotoxicological medicine is kind of an intermediary point where it's not nearly as dilute as the homeopathy, but it's not nearly as non-dilute as, say, the herbal preparation. So still very low potency, but it's not like sort of non-existent potency as it would be for homeopathy. So these homotoxicological formulas, there's lots of different companies that make these. The one that we use most commonly is this company based out of Canada called Viatrix. They're a fantastic company. There's another company called Heal, another one called, there used to be one here in North America called Guna, but they're I think only in Europe now. There's another one called Desbio is one. Oh my gosh, there's another really Pacana is another one. So there's a bunch of these different companies that make these drainage remedies. And essentially they're combinations of different minerals or vitamins, or sometimes they have diluted cytokines, or they have different herbal formulas that are in these different combinations that basically are all formulas that are substances that historically have been affiliated with supporting say the kidneys for that drainage pathway, or the lymph for that drainage pathway, or the liver for that element of drainage and whatnot, or the skin. And so those homotoxicological formulas, these drainage remedies, they can really pack a big punch. I have some patients where they just love their drainage remedies. They find that when they take it, their sinus congestion gets better, their ear congestion gets better, aches and pains might get better. And so I've certainly seen some notable improvements with those drainage remedies before, but it's not something that I see helping patients all across the board. I have colleagues out there, they swear up and down that drainage therapy is like the fulcrum of their treatment protocols, and it's just the cat's meow. I've used drainage therapy with a lot of patients over the course of time, and again, some have really been helped by it, and some it just does not move the needle in any meaningful way, shape, or form. So as per usual, not a one-size-fits-all for everyone, but some patients, especially patients who tend to be on the more sensitive end of the spectrum, who kind of react to things more easily, or who respond to much lower dosages of medications or treatments, they're the patients who tend to be the ones that might have a more favorable response or more impactful response from working with different drainage remedies. So the drainage formulas, the certain herbs are the kind of internal things that I've seen have the most impact on the lymph, but then the targeted skin brushing is hands down the most effective. Now, I should say, hands down most effective thing that a person can fairly easily do at home in terms of found the strongest way to get the lymph moving is to work with someone who does manual lymphatic drainage, so either a massage therapist, physiotherapist, osteopath, like someone who's done the training in manual lymphatic drainage. That is an incredibly profound way to get the lymph moving, but unless you have one of those folks move in with you, or you can afford to see them every single day, then that's not really a sustainable therapy to have as part of a day-to-day regimen per se, but that is a very potent way to get the lymph moving as well. So I hope that answered the question. If anyone has any questions on this topic or anything else, just post in the comment section below, and I'll do my best to answer as soon as I can.